LEADER is a global trial that demonstrated that liraglutide is superior compared to placebo with regard to cardiovascular outcomes. And a clinician, if he asks whether the results of such a trial are applicable to his or her population, he or she should realize the participants in this trial, do they reflect my patient population? And we should realize that although with such a huge number of participants, more than 9,000 in LEADER, of course the results are very robust. But we see averages, we see means, and theoretically it could be that liraglutide is more beneficial to some people than to others. And that's why we looked at the baseline data, and we saw that people from the US, participants from the US and from Europe, they differed in some aspects. For example, in the biggest group of participants of LEADER, those with a history of cardiovascular disease, US participants had a higher BMI, they had a lower blood pressure, they were less people with left ventricular disease. On the other hand, they had a higher A1C, so their cardiovascular risk might differ. And in fact, we should have calculated each individual calculated risk and then make an analysis to see whether the overall results are applicable to those with high risk and low risk. And another interesting aspect is that we saw that whether people come from US or from Europe, independently from all other risk factors, so BMI and whether they smoke or not, whether they have a higher blood pressure, if you live in the States, you have a more than 50% less risk chance to achieve your A1C level. But you have a higher chance to reach your blood pressure level. So one could say that's because of the setting of the target, that's because the treatment of the physician, but we also adjusted for the treatment of the physician. So that might suggest that participants from the US and from Europe, they behave differently. Or they come from different clinics. We do not know. And it's also not only a matter that is an issue for the LEADER trials, for all global trials. We should take very carefully into consideration that all these means they are not automatically applicable to our own patients. An average patient visits his or her physician or nurse a couple of times per year, let's say on average 4 times per year. But almost all of the time he or she has to manage the disease, him or herself. Self-management. And self-management depends on many factors. If I say to my patients 4 times per year, you should stop smoking, you should be more physical active, you should 4 times per year. But what's happened at home? Yes, and we know there's evidence that self-management depends on the support of, for example, the husband or not. Does he support you or not? It depends on how your salary, the worries you have. But it also depends on the perceptions of patients. I always use the example, let's say we have two individuals, 60-year-old, all well-controlled hypertension, all heritage from their mom, because their dad has no hypertension, but the one mother is 92 and still alive and vital, and the other got a big stroke when she was 48. And everyone realizes that these patients, they have a total different perception of what hypertension is. And we should discuss this with, how do you perceive your hypertension? Do you feel it as a threat or not? And also about your diabetes. And talking about these topics with our patients, then we can make a shared decision about what you need, what do you want. What do you want to achieve? What kind of help do you want? You want to bring me your spouse to the surgeon? Okay, let him or her come. Yes, you have troubles in your work. Okay, how can we solve that? So that means that the physician has his own responsibility from a biomedical point of view, but people want to understand, but also want to be understood. And that's the question. If we make patient-centered, that does not mean that the patient says what's happening. No, we together we say, but we take into account that self-management is a cornerstone, and it happens not in the surgery room, but it happens outside, and that's what we should discuss. And in my vision, that's patient-centered care, and it's evidence-based that it is related to heart outcomes.